uh, to everyone about Dr. Setna. He's a surgical oncologist since the last 33 years. And he's in Bombay. He's an MBBS, MS, DNB, and FRCS. And has seen a lot of cancer patients, has done a lot of critical surgeries. And here we can ask him a lot of questions about how to prepare when going with the surgery, especially related to cancer. So let me introduce to you all about Avana Health. It started because of my journey with cancer. I was diagnosed with cancer myself, and when going through it, I have learned so many things myself, and I thought that I should delve into it and help people around it, because there is so much confusion from the diagnosis point of view to what can be done later on. So Avana Health is basically an integrative platform, a healthcare platform. We manage, help, prevent, and reverse chronic lifestyle diseases related to cancer, cardio, metabolic, and also infertility. We have a team of integrative medicine practitioners. We have nutritionists, we have health coaches, we have movement experts, we have mental counselors. It's a complete online and virtual platform. And we, as I told you, cancer being one of the major part, and why we started it, and because the journey started with my story. So let's start talking about what is cancer prehabilitation. So, Dr. Chetna, if you can, I have just included very basic points that we can include. What is basically what happens with prehabilitation? People don't understand. People don't even think to understand the symptoms, or then they don't even prepare their body. So we can just pinpoint what is prehabilitation and what does it include, and how can someone who's got just the diagnosis of cancer include this and understand how to prepare themselves.
Yeah, thank you very much for having me over for this webinar. Uh, I would like to say a few words before I begin on this topic.
Sure.
I was a hardcore allopathic practitioner, and I was introduced to holistic medicine by a person who became a very good friend of mine, Dr. Suryakant Shah. I don't know how many of you all would know him.
Yeah.
And he unfortunately passed away a very untimely death. I think he was full flow of life, and he was a very helpful person to whoever went to him. So I would like to dedicate this session to Dr. Suryakant.
How nice.
And okay, so now coming back to this topic, uh, see, cancer is. Let me start with what is cancer. So cancer is. I'm sure all of you all would know that the body is made up of trillions of cells, and these cells are programmed like a computer to reproduce, grow, function, and have a timely death. Cancer is like a virus that corrupts the software program and throws it into disarray. So you will suddenly have a sudden and uh, extremely fast proliferation of cells that do not perform any notable function, and they keep growing in the body. They thrive off the body. They parasitize on the body, and they are almost immortal. They do not have programmed cell death like most of the other body cells would have. So that is what is cancer. So is it whenever what is our goal in treating cancer? Of course, the goal in treating cancer, most people would say, is cure. But I would say that if we could strike some sort of a balance between, it may not always be possible to kill the last cell of cancer, but if we can strike a reasonable balance where the growth can be controlled, I think we would have won the battle. So that is the way I would look at cancer.
That's fantastic. A very different point of view I've never heard from any oncologist.
So coming back to prehabilitation, the question that you asked us,
Yeah.
prehabilitation it is actually an old concept which has now uh, gained a lot of popularity in oncologic circles. And it is like when, let's suppose that you are preparing for a marathon. So you have to practice for it. It's not that on the day of the marathon, you will be able to run across the required distance successfully and complete the marathon, unless you have practiced before. So what does prehabilitation do? Prehabilitation builds you up to face whatever treatments are going to be offered to you by way of cancer treatment. So cancer treatments can be quite toxic, they can be quite taxing, and they can really drain the body. They can be, the treatment sometimes is worse than the cure. So to be able to successfully complete this treatment and gain some measure of success over the disease, it is necessary that we prepare ourselves for it. And that preparation is known as prehabilitation. So, what I would understand by prehabilitation is it be put in a very nice sentence that preventive prehabilitation is a much better concept than having, as opposed to restorative rehabilitation. So, what do I mean by that? That the preparation that you do before you undergo any treatment is much better than trying to correct the after effects or the debilitating effects of the disease and the treatment after the treatment.
Right.
So basically, it's like a Olympic uh, athlete trying to build up stamina before
Right.
he undertakes the final event. So that is how I would understand rehabilitation.
But Dr. Setha, one question I would want to say, I don't know whether, after the diagnosis, uh, when you go to the doctor and they straight away tell you, oh, or maybe make you so uh, scared that they said that, oh, now you need to just straight away go into surgery, straight away go into doing these kind of treatments. Is there any timeline we should, anybody who's got the diagnosis should take?
Uh, yeah, so let me come to that too. Let me explain to you. See, if a cancer is so serious, the condition of the patient is so serious that if he does not undergo some form of treatment immediately the next day or within the next few days, he's going to die. Well, there are very few such situations actually. So, cancer is actually not, as most people perceive, a rapidly growing disease. It's a slow growing disease. For example, this is what I'm going to tell you is an established fact. Women commonly get breast cancer, and for a palpable lump, for a lump to be palpated easily in the breast, it has to be at least 1 centimeter in size.
Right.
To reach that 1 centimeter size, most types of breast cancer would take almost 5 years. So
Wow.
it's when you notice that small 1 centimeter lump, it is a small lump. And in fact, it is known as early breast cancer, but it is actually 5 years old. Then 1 centimeter lump is 5 years old. So supposing you go to a doctor today and he tells you you should get operated tomorrow itself, well, I would choose to ignore such advice.
Okay.
Unless, of course, there are certain factors which mandate immediate treatment, like your are bleeding, or it is you're likely to go into some sort of bowel obstruction,
Hmm.
or there is likely to be a perforation in the bowel. So those are emergencies. But in general, there is no emergency just immediately after diagnosis of cancer that mandates immediate treatment.
Fantastic. It's such a valid point and a important point for people to know, because generally it is so scary. People just don't wait and they
There
straight
are a
away
lot
go
of
into,
market economics sometimes that drive this sort of advice.
yeah. Even for say Dr. Setna, I want to know that a lot of people go with the surgeries. Like first, if they are advised for surgeries, and immediately after 1 week or 2 weeks, they are advised to take chemotherapy or radiation. What is your opinion
No,
about?
no, no, no. See these things they follow a definite time pattern. Now, uh, okay, let me give you a little bit of theoretical background to this.
Yeah,
So there are many cancers nowadays which we first treat with chemotherapy or with chemotherapy and radiation before we operate nowadays. So surgery is not the first choice of. I mean, yeah, it is a choice of treatment, but it is not the first thing that you would do in the treatment. So a lot of bowel cancers, like especially rectal cancers, esophageal cancers, uh, breast cancers, even some head neck cancers, which are very large. So we first try and shrink them. See, the less that we do, the less that we operate, the less that we disrupt normal anatomy and physiology by surgery, leads to better outcomes.
right,
So uh, we try and shrink these sort of lesions. So we should understand that cancers do not, it's, cancer does not have a single type of cell which predominates. So there are multiple types of cells in that tumor. So
mm,
some of the cells may respond to the chemotherapy, some of the cells may respond to the radiation, and surgery, of course, would remove all of it completely.
right,
So nowadays, most cancers would have a combination treatment of all these things, either chemo, radiation, followed by surgery, followed by more chemotherapy, or just chemotherapy, followed by surgery, followed by more chemotherapy and radiation after that. So some of these uh, combinations are followed. Rarely does it happen that only a single modality treatment is followed. That is only if the cancers are extremely uh, small, early, and they have good features that are recognized on the microscopy as reasonably good features, which may not predict recurrence.
right.
So generally, we have these three. So the idea of having all three treatments together is that whatever is chemosensitive will respond to the chemotherapy. Whatever is radiosensitive will respond to the radiotherapy. And there may be some cells which may be resistant to both these sort of treatments. So when you remove the whole tumor, all the majority of the cells which are resistant are also removed.
Yeah,
So by that we hope to achieve some semblance of a cure.
understood. Great, such a nice, I mean, very insightful information. Also, let's talk about the difference between prehabilitation and rehabilitation. Uh, so, as we know that prehabilitation is the first stage towards rehabilitation, and even if you can throw some more light that usually how the rehabilitation works, because I've written out here that it begins from the
Yeah, so
yeah,
rehabilitation in the sense is that, see, there are a lot of changes that occur in a patient who's got cancer, especially when they come with advanced cancer.
yeah,
So when they come with advanced cancer, they may have various problems such as they may have very low reserves, they may be fatigued, they may have anemia, and they may have loss of muscle mass and weakness. They
Yeah.
may have loss of appetite, unintended loss of weight. So all these factors are lead to abnormal physiological functioning of the body. And on top of that, if you add an onslaught of either a very vigorous chemotherapy regimen or a radiotherapy regimen or aggressive surgery, these patients are not going to do well
Mm.
because function is already compromised.
Right.
So we have to, since we know that cancer is not all that a urgent condition, we do have some time to help the patient recoup a bit on his own. So we can do that is what is known as rehabilitation or prehabilitation. So you help the patient to get back to some sort of normalcy. So in medical terms, we usually have what is known as we call this as a catabolic phase and a anabolic phase in the
Mm.
body. So anabolic phase is when the body is building up cells, regenerating tissues, repairing injured dead tissue. So that is known as an anabolic phase. A catabolic phase is when to meet your daily energy requirements, the body is breaking down its own proteins, and mostly these proteins are broken down from the muscle mass. That is why
Right.
you'll find that patients with advanced cancer are looking very thin and worn out and haggard.
Yes.
So that is the reason why that you have that sort of appearance in these patients because they are drained of their body
Right.
protein. And as most of you all would know, cancer thrives on glucose. That is the substrate which it uses as its energy
Yeah.
source. So because the patient is unable to eat, because the person is unable to eat well, he doesn't have an appetite. So how
Mm.
does he get glucose? So he gets glucose from breakdown of muscle proteins, which is then converted to glucose, which is known as gluconeogenesis.
Mm-hmm.
So muscle proteins are what? So now when you are considering rehabilitation, you are rehabilitation would consist of first of all physical exercise to
Mm.
build up some muscle mass and to give some strength to the body. It consists of nutrition, maybe forced nutrition in the form of tube feedings, or in very rare conditions, intravenous feeding with special solutions. Always better to use the normal oral route for feeding, and also psychological counseling for the patient.
Right. In your document, which I was going through, we've written the stages of rehabilitation. It's like the pre-assessment, as we already
Yes.
spoke. Is there is some measure baseline which the doctors often.
Yes, so the most basic things which even you all must be familiar with is you take the height, you take the weight. Height, of course, doesn't change in an adult, so you take the weight of the adult. And there are various other measurements that you can follow is the mid-arm circumference. You
Right.
can see the skin fold thickness. So
Yes.
these are some of the measurements that can be made. You can calculate the BMI from the height and weight of the person. So BMI gives you some idea about what is the nutritional status of the person. Now, mind you, even obesity is a sort of a malnutrition. So you should not think that a guy who's got a BMI of over 30 is healthy. He is also in some form or the other having some malnourishment.
Right.
So when you are looking at height and weight, you should keep this in mind. Then there are a lot of risk factors which are to be assessed. So in risk factors, we have to look at things like what is the cause of this cancer? Is there a known cause for this cancer, like smoking, drinking? So you have to obviously advise the patient to stop. Now, does people may ask that, okay, I've been smoking for 40 years now. I only maybe 1 or 2 years of my life. Why should I stop smoking? So you have to stop smoking because smoking has many other effects besides just causing cancer, being a cause of cancer.
Right.
And if you stop smoking, it improves your lung condition to the extent that you can withstand major operative procedures. You are able to recoup better if you have stopped smoking well in advance of the surgical procedure. So these are some of the immediate advantages of stopping smoking. And there are other risk factors like you have to know the extent of disease. That plays a major role in determining what sort of treatment plan you're going to adopt for this patient.
Right.
So the extent of disease, the extent of surgery, both are important. So there are certain conditions like ovarian cancer, which can require extensive surgery, or certain conditions in bowel cancer where there is spread to the rest of the abdominal cavity. So that can require extensive surgery, and we also put in chemotherapy solutions into the abdominal cavity for that, or into the chest cavity if it mandates that. So these are very extensive surgical procedures. So we must be sure that the patient is able to withstand these procedures. There's no point in having what was a popular phrase in the past, operation successful, patient died.
Mm.
So we should not run into that sort of a situation.
Right. Great. Also, would like to know from your journey, Dr. Setna, like when we spoke first, you said that you see a lot of young people succumbing to,
Yes, a lot of young people are coming in. In fact, right now we have a 20-year-old who's got a very bad rectal cancer, whom we are treating, and I don't know if he will really get through it.
oh gosh.
So there are a lot of young people who are coming in, particularly with bowel cancers.
Is there any
And
particular
they are
reason?
mostly rectal cancers. And these are mostly, I would say, there is some genetic reason for this. Now, we cannot get to the bottom of this in our patients, mostly because of financial constraints, because investigating genetic cause in our patients is a very expensive affair, and their families just cannot afford it, and these services are not available freely in government hospitals.
Right.
But these have to have a genetic reason,
Hmm.
and somebody in the family usually has a similar sort of a tumor, and subsequent generations too may suffer, and the siblings of the patient may also be suffering from this particular form of disease.
Right. So how can it be conquered? Like if we have to
This
say,
is this is something for the future. I don't have an answer to that. This is something for the future. Whenever we get smart enough to manipulate genes and be able to correct them,
right,
maybe that's the time this will probably disappear. Till
understood.
such time, we have to put up with it.
Right. But do you think lifestyle interventions can definitely help?
See, lifestyle interventions are different. Lifestyle interventions don't occur in 20-year-olds.
Hmm.
Lifestyle interventions occur in your mid 40s or 50s when you have been using some substance abuse for the last 10, 15, 20 years. So, uh, yes, lifestyle changes do matter. You have to, uh, what is known as moderate drinking is one peg for a woman a day and two pegs for men a day. So that is considered to be adequate moderate adequate moderation in your drinking habits. Smoking should be totally cut off. if you're employed in a hazardous occupation like in the asbestos industry or in some sort of mining industry or even in some aspects of the textile industry where there's a lot of that cotton flash and all flying around.
Hmm.
So occupational hazards are a big issue in causing cancer. So these are some of the lifestyle habits that require changing. Uh, Dietary habits. It has been found that there are certain cancers are more common in the obese, like breast, uterine, prostate, colon, pancreas, more common in obese people who are obese. So, healthy weight and good exercise, moderate amount of exercise throughout the week is a good thing to do for most people. So, you have to modify your lifestyle to such an extent. And of course, this is proven beyond doubt that the more raw foods you eat, the healthier it is, and it can prevent occurrence of cancer.
Definitely, a plant-based diet is more.
No, there's no such evidence that a plant-based diet is better, but at least not in our field. But a vegetable-based diet and raw vegetables or fruits definitely offer a healthier option to processed foods and cooked food.
Right. Great. So next topic we want to discuss is when you get the diagnosis, is that you are surrounded by fear, the family members are surrounded by fear. Everybody thinks that something so drastic is going to happen, you're going to die.
Yes.
And this happened with me as well. I thought that my life has come to an end because there's so much of fear around the word of cancer. You hear the word cancer and you think that it's like a death sentence.
Yes, actually, this is, I think there's a lot of uh, hype about cancer also. There are a lot of patients who die of so many other diseases which are not, I mean, they are not advertised to that extent. For example, renal failure is one of the most common causes of death in organ failure. So nowadays, transplant has become more common. It is carried out pretty much successfully. So, but how many people can really afford it?
Hmm.
So even if you afford the event of transplant, that whole event where you can have a transplant of kidney or liver or whatever, you need a lot of, sorry about that, there's some shooting going on in this area, so
That's okay.
a lot of disturbance. So even after you've undergone the transplant, you need to be on constant medication, which is a big drain on your pocket. So not many people can afford it.
Right.
So there are a lot of other diseases. So which can cause death. For example, if you get a stroke, a bad stroke, half your body is non-functional,
Hmm.
you are likely to die in the next 2 or 3 years,
Right.
which is about the same time as having a diagnosis from cancer.
Hmm.
So there are a lot of other diseases, chronic heart failure, stroke, incapacitating heart attacks, where you can barely manage your heart function is so poor that even getting up and doing your routine daily activities, bare minimal activities is causes breathlessness. People whose lungs are so badly affected with tuberculosis that they get breathless at the slightest amount of exertion.
Yeah.
So there are a lot of these diseases. So I don't think that cancer has become a bit hyped, and the pharma industry has a big role to play in that, I guess.
Yes.
So,
Pharma industry, a lot of, people like in films, somebody's got cancer.
yeah, so it is, I would say yes, it is like any other disease. I mean, except for infectious diseases, I do not think that we have managed to cure any disease condition as such
Right.
in this world. Yes,
Right.
we know the cure for malaria. We know the cure for dengue. We know, perhaps we know how to treat bacterial pneumonias. If someone gets appendicitis, I can cure that person by removing the appendix. If he gets a
Yeah.
hernia, I can cure it by operating on the hernia.
Hmm.
Most other disease conditions that you see,
Right.
they are controlled by medications. They are not cured. So you
Yeah.
have to keep taking drugs lifelong. For example, uh, some of those group of diseases known as connective tissue disease, like SLE or
Yeah.
polyarthritis, you have
Hmm.
to keep taking drugs for till as long as you live.
Hmm. Right. Yes.
So
So
I
people.
don't think cancer also comes in that group of diseases.
Yeah.
Yes, it has a different mode of presentation. It has a different mode of pulling you down, but ultimately it's the same thing that we do not have a handle on this disease as of now to be able to confidently say yes, you will get cured.
Absolutely. It's the whole point is just to ask right questions and get informed. Well, as you said, like, you need to pre-assess and you need to find a very good hospital and doctor to investigate your case,
Yes,
and you ask the right questions, because then if you are not informed well, then you can't take proper decisions, like, in terms of nutrition, in terms of changing your diet, in terms of changing your lifestyle around. That's important factor. So even if what I also went through was, like, I joined a lot of forums, I studied, I spoke to people who have gone through cancer, and obviously, as you said, that we there is a lot of changes physically one can go through. You lose weight,
yeah,
so you need to anticipate those kind of physical changes as well, because
yes, yes, you need to.
and
And you need a lot of support uh, for all these, in all through the different phases of treatment. There are times when you'll be very depressed. There are times when chemotherapy will make you feel miserable. Your
yeah,
surgery will leave you debilitated.
yeah,
There will be, I mean, for women, when there's suddenly you remove their uterus, ovaries, or breast, or something of the sort, there's loss of identity.
yes,
So all these sort of things do happen.
yeah, it's true. And especially when you know that you're going to lose all your hair. For women, it's like devastating.
Yes, yes. Actually, for us, loss of hair, we don't really look at it as a very major thing. But for that particular individual, it's a big event.
It is, absolutely. And also, then I feel that even someone, like, my coping strategy was writing a lot. Like, I used to journal, I used to write my thoughts and
Yes,
discuss.
all there has to be some way to keep your mind off your disease
Yeah.
and focus on the better aspects of life. So it can be anything. I mean, some people have been very creative. They have studied literature. They have studied philosophy during their illness. They have uh, founded small sort of organization where they can help people in a similar situation. So that keeps their mind off their
Yeah.
condition. So a lot of these things go on. So
Yeah.
otherwise, you need, if you are not such a strong-minded person yourself, then you need a good support.
Yeah. That's true. And it is also that, like, there will be very good days, there will be bad days.
Yes, correct.
You need to go through them and you just need to be positive. What do you think, like, how does strong mind and positive mind plays an important role in you want to discuss any case history of yours, or which is like absolutely
Uh,
Mhm. Any case coming in your
yes.
mind you would like to share with the audience to just inspire them?
So yes. So actually, uh, she's this is a lady who I obviously won't name her, but she stays close to the hospital where I work in, Sion Hospital. And she used to visit a hospital very frequently with patients. She used to help them out with, you know how government hospitals are. It is difficult to find your way around, get things done. So she would help patients
Right.
once they have been given certain advice on how to go about fulfilling what things that they have been told to do, completing things that they've been told to do. So she used to help them around. And one day she came to me and said that I have a lump in my breast. So examined her. There was, I mean, no doubt in my mind about what it was. And she accepted the diagnosis very calmly. She said, well, I don't want, I usually advise most of the patients that I see to remove the breast completely, because it's not that it is a better operation than removing only that part of the breast which has the tumor. But
Mm.
with such an operation, you may be able to avoid radiation. So that cuts off costs and extension of the treatment
Right.
if you remove the whole breast. So most of our patients, they're older patients, they're in their 60s, they wear a, most of them wear a sari, so it's not very obvious. So, and they agree to, because radiation is not available freely in the city, at least not at the cost that they can afford. So they find it easier to do away without radiation. But this lady insisted on retaining her breast. So we said, okay. So we removed only that part of the tumor. And she was okay. We gave her some chemotherapy. She was very irregular with the chemotherapy. Now, I'm not telling you this story to give you that example, but she was very irregular. She would, nahi, aaj man nahi kar raha hai. No, that sort of a thing. So she would come, instead of the 3 weekly interval, she would come at 5 weeks or 6 weeks. And because we knew her so well, we would tolerate it and keep doing it. And then uh, she finally managed to complete her chemotherapy at a much later date than what she had to. And she was okay for 2, 3 years. Then she started complaining of backache. So again, the diagnosis was very obvious that she has got some spread to the bones. We got her investigated. So she had some disease in the bones. And she had such severe pain that she just could not get up from bed. So everything was done. I didn't see her for a couple of years. She used to keep talking to me on the phone once or twice. She called me over to her place. I went and met her there. She wouldn't get up from the bed. And I don't know what she has done, because she just keeps saying that ये तो खुदा की इच्छा है. But she's up and about and she's perfectly okay.
Wow.
Uh, So we
Amazing.
did treat her in that condition too. We did treat her. We gave her some radiation. We gave her some more chemotherapy. We gave her some tablets, hormonal tablets to take, and all that sort of thing. But as usual, she was quite irregular. On a good day, she would refuse to take anything, and only when she became very bad, she would take all these things. But in spite of that, in fact, she called all the doctors in our unit just last week for a sumptuous lunch to her place.
Okay.
So I have no message to give you from the story, but it is what I would like to tell you is that it's the attitude of this person.
Yes.
Never give up attitude. I mean, whatever happens, I'll manage it. I'll face it. I'll take care of it.
Yeah.
And the Lord above will help. That sort of a thing.
Absolutely. I think attitude plays such an important role in
So,
fighting anything
yes,
in life, especially the disease when the body doesn't really cope up with you, it is the most difficult thing. And health, then you realize
the
that,
importance of health,
oh
yes.
my God, yeah. You like hard mein jaye everything, you have
Yes,
so much
correct.
wealth, this, that, but it really doesn't matter. And I tell people that start early, start taking care of yourself early so that you don't really end up doing.
Yes, I mean, yeah, your body should not be the center of your attention, but yes, you have to take care of it so that you are healthy as long as you live.
Absolutely. Also, Dr. Chetna, stress. Now, I want to talk about majorly about what is your understanding of cancer and stress. You think that stress can trigger?
Uh, I don't know. I really don't. But yes, if stress can cause a lot of other diseases, like this is a well documented fact that stress does cause hypertension. It does cause diabetes. So, yes, it is a known factor that stress causes these things. But whether it causes cancer, I don't know. See, sometimes some people they have this habit of constantly thinking and have a very negative sort of attitude that I've got this, I've got that, I've got that. And ultimately, after a few years, you do find that they do have those things that they are imagining all this time. So I don't know, Baganesh. I really
How
cannot
about
comment on this.
managing? I mean, with the surgery and with the kind of treatment, especially with surgery, if you say people are stressed out and people are, you know,
Yes, that
understand.
see that see the stress of a particular event is different from having a constant stress throughout.
Yeah,
So yeah, so like uh, if you tell me that I have to go through a surgery tomorrow, obviously I'll be a bit uneasy. There'll be some disquiet in my mind about it.
yeah,
But I would be able to get over that situation quite easily. But having that sort of a situation constantly, every time that every moment that you're awake is not a very healthy thing to have.
right.
So, I mean, if you find every event that occurs in your life as stressful, then there's something wrong with your attitude.
Absolutely. And I think you're constantly in that flight and fight mode, right? When you
Yeah.
are stressed out, when you're overthinking,
Yes.
you're not like the
So
body.
I think I had attended one of those seminars, right? And I think there was one Dr. Bhasim from Delhi,
Hmm.
and he had given a very nice talk on all these stress hormones which are released and how it affects
Cortisol.
your health.
Yeah,
So he was talking about adrenaline, noradrenaline, dopamine, serotonin, all these
yeah,
various chemicals that can stressors, de-stressors, all these sort of things.
absolutely. I feel as I can't say much about the scientific reason, but in from my life, I was highly stressed person. And like as you said, overthinking, negative thoughts, this,
Yes.
that.
So
So
that's not a good thing to do.
yeah, and
And
even
usually I've seen that when we have such patients, the results are not good.
absolutely.
Treatment results are not good. So you
Yes.
have
So
to put them in a good frame of mind. You have
yeah,
to reassure them constantly. You have
yeah.
to get their friends, relatives to constantly reassure these sort of people that things are good.
Yes. That is very true. Actually, people don't, they just see as any event, but if you really calm your mind down and if you just accept it and go through it as one day
Yes,
as it comes, I think it becomes very easy. And
correct.
you just anticipate certain things. That's the reason you just need to, like, nurture yourself and just try and
Yes, yes,
exercise as much as you can, get enough of sleep, and do some relaxation techniques which will just help you to cope up
right.
with the surgery and cope up with the
Yes,
treatments.
correct. In
Yeah.
fact, I don't know if you've read a book by, I forget the name of the book, but I remember the author's name is Dr. Bernie Siegel, who
Okay.
was a cancer specialist in the US.
Hmm.
And in his book, he describes a patient. So he was treating a patient who had a lymphoma,
Okay.
and in that book, he writes that there was a new drug which had come out at that time, and he told the patient that, see, this is supposed to be a wonder drug for lymphoma. So would you consent to taking this new drug, which is not really, I mean, it's not proved beyond doubt, but would you consent to taking this drug? So that patient agreed. He was given the drug, and within a few months, everything disappeared. So everyone was happy. Now, what happened was a few years later, research on this drug was ongoing. And a few years later, there was a small newspaper clip which said that this drug is not good for lymphoma.
Okay.
This man came back to his doctor, to Bernie Siegel, and showed him that news clip. And he said, Doctor, I've been fine all these years, but these guys are saying that it's not good. And I think I'm going to get this disease again. And he did.
Oh, wow.
It just came back. But what Bernie Siegel did is he realized that this guy is he's psychologically a very high strung individual.
Yeah.
So he said, no, this drug is good for people like you. You do not have access to the full information about the drug. But this drug is very good for people like you. And he gave the same drug again. And he said everything will disappear. And it did.
Wow. That's
So that
amazing. The power
so
of mind, the power of
yes,
thoughts.
yes.
It is. It plays very important role. And
It's very important. Yes, it's very
yeah,
important.
and books like, I don't know if whether you have read about how you can heal your life. So that's one of my books which actually saved me. And they talk about affirmations. They talk about how to talk to yourself. They talk to your body, and you give yourself love, and you give yourself the positivity, and you give, you build that ecosystem around you so that you're enough and you love yourself. Most cancer patients, I feel that they start uh, believing in themselves, and also
Yes.
loving themselves as much as they can. So I think the mind plays a very, very important role in healing, and even accepting medication treatment. So I think that's why at Avana we always tell that we need to counsel your mind, your family, and your system around, so that
That's true. It's very important, but I don't think that. I think this aspect too is still left to the in our country at least. It is still left to the clinician, and I think we have picked up some habits from the Americans where we are very abrupt and we tell the patient upfront that see you have got cancer. This is what you're supposed to do. If you don't do this, this is what will happen. That is what will happen. So you better follow our advice.
yeah,
So it's a very parochial way of counseling patients that has to change. And I think we should have a psychologist on the team, a psychiatrist on the team who can counsel the patient about this.
absolutely. I completely agree with you. Absolutely. Even for that matter, even these alternative therapies, Dr. Setnath, they really help
Oh
relax.
yeah, they do. They inculcate a very healthy sort of a lifestyle, and they help by sort of giving you all sorts of nutrients. They make
Yes,
you feel light and happier than what
absolutely.
the type of diet or type of lifestyle that you are following.
Yeah, great. So, guys, if you have any question, please let's start asking them. Or I have a couple of questions myself. People have sent it to me, so I can ask those as well. And if you all have any questions, please put it in the chat box. Dipali, let me know. And Dr. Setos, there's one question about uh, that we've already covered the major points what we have to take in consider the surgery, or if somebody has asked to say that they have to go to surgery. The question is that if a person is undergoing any other kind of diseases, for that matter, if they have diabetes, or if they have
Yeah.
any other major health problems like blood pressure. So in that case, what should they like? Should they wait? Should
No, see, the majority of our patients nowadays have blood pressure and diabetes problems.
Right.
This is both these diseases are quite rampant.
Right.
So I think 1 out of every 4 or 5 patients would have diabetes and blood pressure.
Yeah. India
So
has become the number one capital of
yes, for
diabetes.
diabetes, yes. And so uh, as far as surgery goes, diabetes is not, as far as the surgical procedure, I would say, not the surgery per se. As far as the surgical procedure goes, diabetes is not such a big issue as long as it is reasonably controlled. Even if your sugar is 200 or 250, at that time, it is not such a big issue because it is controlled by giving insulin at that time and getting it down. As far as blood pressure goes, yes, blood pressure has other problems that you can get excessive bleeding during the surgery or immediately after the surgery if the pressure is not controlled and it shoots up way beyond. So blood pressure is more of an issue for the surgical procedure per se. But yes, it is correct that whilst we are advocating prehabilitation, these factors have also to be taken into account and controlled. So it is better to have a patient who's got good sugar control and good pressure control. It's much easier to treat such a patient and expect a good outcome than to treat a patient who has uncontrolled pressures and sugar levels.
Right. And even after post surgery, you think,
Yes, post surgery too, because see, in both these conditions, see the main concern about a surgeon is not only getting through the procedure safely. The main concern in surgery is bleeding.
hmm,
We don't want blood loss. Another thing is that which is a well-known fact, is that we should curtail or avoid blood transfusions in the perioperative period. So before, during, and after the surgery, we should avoid blood transfusions because it is known to depress the immunity to some extent.
okay,
So we do not want, as far as possible, we would avoid giving transfusion. But if we just cannot avoid it, of course, and it is life-saving, you have to go ahead with the transfusion. You
hmm,
cannot say it's going to lower immunity, so we'll take a risk and not give him the transfusion. So we can't do
right,
that. But
right,
it is better not to use blood or blood products in this perioperative period.
right,
Also, both these diseases, they are diseases that can cause a lot of damage to blood vessels all over the body.
hmm,
So uh, it's better to have these things under control
right,
rather than start damage control at a later date.
right. And the next question they've asked is about having the port inserted fit after the surgery. I mean, I don't know whether
I'm sorry, I didn't get it. What was it?
the port which is there, which they use for
Oh, the
chemotherapy.
chemo port.
Yeah.
Uh-huh.
Is there any timeline to keep it or we can remove it?
See, this port actually is made of inert material, and I always encourage patients to keep it as long as they can. Of course, there are various types of ports that you get. The port that I generally prefer to use, even in a public hospital like Sai, I prefer to use a high-end port because it actually works out cheaper and easier for the patient in the long run.
Okay.
So this is known as a Groshon port, and it needs to be flushed only with normal saline. You don't need to flush it with anticoagulants like heparin, and it can be done once every 3 months, not every month either.
Oh, really? I used to do it every month.
So that is an older type of a port, and if you have to do it every month, because the needle itself costs anywhere between 500 to 700 rupees, if you
Yeah.
remember.
Yeah.
Because it's a special sort of a needle that you get.
Right.
So I always prefer to use this Groshon port, which is, and I always prefer to use this Bart company ports because the kit comes with steel needles. So we keep using the steel needles till they become quite blunt because we
Okay.
can re-sterilize them and use them. So it
Oh,
avoids extra costs to the patient.
fantastic.
So yes, and these ports are supposed to be able to withstand up to 2000 punctures.
Oh, okay.
So you can keep them for a very long time. There's no need to. So another thing is that in most cancers, most I'm not talking of exceptions here. In most cancers, if recurrences have to occur, the first 2 years are extremely crucial. So if you have crossed the first 2 years, the chances of recurrence recede. Now, that is not the case with breast cancer. Breast cancer can recur at any time during your lifetime.
Hmm.
So, but most other cancers, 2 years is a sort of a good cutoff time. So, if after treatment ceases, 2 years after that, if nothing has occurred, I would remove the port. So, I would still encourage the patient to keep it.
Okay. That's a very good point actually to
So, if
understand.
you use this particular type of port, then you are at some advantage.
Okay. That's very informative. Uh, Fine. So in the end, Dr. Setna, if you want to just share 3 points with anybody who's got diagnosed with the cancer, you want to give them your advice.
So, the first thing I say is not the end of the world.
Yeah.
There are, with all the current research and whatever improvements and treatment protocols are going on, things are getting better and better. Yes, they are getting more expensive, they are getting more complicated. So, what used to be advised by just one doctor, previously, you have to now visit at least two or three specialists, even in cancer.
Hmm.
So, it's not that you just go to one cancer surgeon or you go to a medical oncologist and he's able to give you the best possible advice for everything.
Right.
So, it is always better to go to a big institute for such treatments because all sorts of specialists are available, so they can give you good advice. And the most important person in this treatment is you, the patient, who has to keep up his morale and build up some sort of a defense mechanism by which he can overcome this, all the problems and depressions that you may face during this treatment.
Yes, absolutely. You, the patient, is it depends upon the attitude of the
Yes.
patient. It really depends upon that. And also, Dr. Setna, one point I really want to raise out here is people obviously when they get the diagnosis, they say stage 1, stage 2, stage 3, stage 4.
Yeah.
Immediately, the people who are on stage 4, they have they're so scared that they're like, I don't think so I will live. And I've seen when some people, even they have like the attitude matters, and anything can happen with a miracle. You want to talk about, or you want to give any instances where you've seen stage 4 patients just recover?
So, stage four is usually when it is spread beyond the confines of that local organ or local area, then it is known as stage four.
Yeah.
In general, this I'm talking of in general. I'm not talking of things like leukemia or lymphoma, which are a different type of cancer, but I'm talking of solid organ cancers. So, uh, the example of this lady that I gave you is she was automatically stage four once it went to her bones,
Yeah.
but she got out of it.
Yes. So there's always hope.
There's always hope.
There's
Yes.
always hope. That's what I also say. Great. So thank you, Dr. Sedna. It was wonderful
Thank
talking
you
to
very
you.
much.
My God, it was very insightful, and I'm sure people who are watching us on Facebook and YouTube are going to have a lot of information and very well educated. People don't panic when you have get this diagnosis. As Dr. Setna say, there's no rush into getting treatments. Understand your disease, understand what kind of treatments are available, and then take a informed decision. That's very important.
Yes.
Uh, there is, okay. Thank you. Everybody's saying thank you. And
Thank you. Thank you.
yes, so next webinar, of course, is reversing diabetes naturally and living drug-free life with Dr. Liri at 12 December. People do join. And Dr. Setna, thank you. We will keep in touch, and I think we should keep doing more and more informative sessions like
Yes,
this.
surely.
Thank you.
Okay. Okay. Bye bye.
Bye.